to be injecting this lady's lips today. She's very keen to keep and retain a natural look whilst just enhancing her lips slightly. If I just get you to tip your head forward. So what we've already discussed this, but what we want to do is just to do some overall gentle volumization with some enhancement in the lip tubercles centrally. Key thing keeping the lips natural is that most of the lip volume should be in the middle 2/3 of the lip, and very little volume should occur naturally at the outside. So I'm going to use a combination of cannula and a 4mm needle. The cannula is going to allow us some soft and overall volumization, and the 4mm needle will allow us just to enhance the lip tubercles. So she'll have a fabulous and gentle result. So I've already cleaned her skin with some Cliniceps. I use a sterile dressing pack for dermal filler procedures. Now the skin is never going to be sterile, but I think if we can just keep it as sterile as possible, that's always the key. So we're going to be using a cannula to enhance Tina's lips, and I'm going to be using Precise, lovely fine product, very gentle, soft overall volumization for a slightly older lip. This is the needle that comes with the cannula. This is a 23 gauge needle, and remember that we're predicting that the facial artery runs approximately 13mm at the side of the oral commissure. So your entry point wants to be within that. So nice and close to the corner of the mouth. Make a single entry point. There's no need to twizzle and turn the needle round. You're not wanting to cause trauma. You're just wanting to create a point through the skin that your cannula can pass through. So little scratch now, and then take that out. And then you can see there that there's very little bleeding. Sometimes it's worth just giving it a little squeeze like that so that you can find the point again. If that point was to bleed heavily when you first withdraw the needle, I would stop the bleeding and choose a different point. The benefit of your cannula is that it's safer, and you want to be away from blood vessels. So if you've got a vessel that's bleeding heavily at the start, that's not ideal. So we've got our little entry point here, and I'm going to feed the cannula into the lip. So sometimes a bit of pushing and prodding, sometimes patients feel a little bit of popping. And what I'm trying to do here is to try and get into the vermilion border of the lip whilst keeping in the pink of the lip. So you can take the cannula nice and superficially. And we're up to the point of Cupid's bow there. And then I'm going to do a very soft and gentle, low pressure linear thread as I come back down. Okay. Then what I'm going to do is just keeping that cannula again superficially, trying to visualize being in front of the muscle. I'm coming in from the vermilion border, but still keeping it superficially, so I can feel that cannula there. And I'm going to do some volumization this time, just keeping it in the middle 2/3 of the lip without adding too much volume laterally. Okay. I'm going to do the same on the bottom lip. Very gently get into the lip here. Sometimes a little bit of gentle prodding. And again, keeping superficially. You can see there that I'm still in the pink of the lip, superficially in the vermilion border. You're wanting to go to near enough the midline. And again, I'm going to do a retrograde linear thread, very gentle, low pressure as I bring that cannula back out. That's just going to give a little bit of lip definition and help with any perioral lines increasing as well. So again, I'm going to go back in from the vermilion border, keeping superficially, and add some volume to the lips. So what I've done there, you can see that I've enhanced the border, and I've added a little bit of volume in the middle 2/3, not added much volume at the sides here. So we've enhanced the border and we've done a little bit of just general soft volumization. Remember that this lady wanted a very natural look, and what I'm going to use now is the 4mm needle just to enhance the lip tubercles, and naturally the lip should have a little bit of a mound there, and similarly on the top lip at either side. So that's what I'm going to enhance. 4mm needle, remember that your inferior and superior labial arteries are usually almost always sitting deeper than 4mm. So first of all, I'm just going to ask you to open your mouth just a little bit, relax a little bit, that's it. So this is where we're wanting the lip cushion to sit. So I'm just going to pop the needle in there. And you can see there actually a good example of the wet-dry border. So I'm keeping in the dry part of the lip, and I'm going to just inject in and put a small bolus, probably just less than 0.1. And you can see that even before massaging, that natural tubercle has just increased there. So she's going to get a natural shape to that lip. Just put a little bit of pressure on and just minimise any bruising. You can see how once you start using a needle, your risk of bruising and swelling goes up. Get very little swelling with a cannula, and I always find that the results of a cannula are very predictable, so when the patient leaves they will have a little bit of swelling, but it's generally how their lips will stay. Okay, so I'm going to do the same on the upper lip team, then we'll give them a massage. So again, we're staying in the dry of the lip. You can see the wet-dry border's about there, so I'm going to just go in here and add a little bolus. Probably about 0.05 mil. So I think that's probably enough for Tina's lips on this side. So I'm going to give them a massage and then we'll see how they compare. Does that feel okay?
Can't feel it.
So I always use a bit of gauze for massage. It just gives us a little bit of traction. Just pick up the lip and just gently massage. Massage just encourages integration of this product. This is a lovely soft product for overall hydration, overall gentle volumization, and massage just minimises any risks of lumps. Now I've added a bolus there, which by definition is a ball, so it's going to give you that mound. So Tina's not to worry if she feels a bit of a mound in that area of her lip. I'm going to do the same on the top lip. I'm going to massage this side, just between my thumb and index finger. There, how's that looking? Fabulous. So you can see how the top lip has just lifted slightly. Just relax your mouth slightly. And you can see how we've enhanced that lip tubercle there. So it's very subtle, very natural, and we've only used so far 0.4 mil. So very gentle result, and we'll do the same on the other side. So we're going to do the other side. Again, we're going to use our needle entry point somewhere approximately 1 centimetre in from the oral commissure, predicting that our facial artery runs usually about 13 millimetres. So we're going to make our needle entry point, single stab close to the corner of the mouth there, just 1 point in and out. And you can see no trauma, no spinning the needle round. Your needle is bigger than your cannula, so this is a 23 gauge needle, your cannula is a 25 gauge, and you can see that's just got a little pinprick bleed, which is ideal because we can then pick up our cannula and we know where to go. So as with the other side, I'm going to just gently add some definition to the vermilion border. So I'm just going to gently get into the lip here. nice and superficial. Up to the Cupid's bow at the top. Now your superior labial artery classically runs more superficial as we get towards the midline. So again, cannula is just going to be a bit safer at that point. My cannula is nice and superficial there. I can see it, and I'm just going to do a very thin, low pressure linear thread as we come back down there. Then I'm going to go into the body of the lip, again keeping superficially, subcutaneous, so I'm wanting to be in front of the muscle and in front of the wet-dry border. And we're wanting to volumise the middle 2/3 of the lip and not add too much volume laterally. Okay, and then I'm going to do the same in the bottom. Feeling okay?
Yep.
Yeah. How does that feel? Is it reasonably comfortable to be injected? Yeah. So this product, as you know, has no local anaesthetic in. It has a very low extrusion force, so very gentle to inject. I have used topical anaesthesia on Tina's lips in advance, but it's quite a comfortable injection. So we're just enhancing that lip border, and then I'm going to go into the body of the lip again, keeping superficial, keeping above that muscle, and just do some volumisation in the middle 2/3. Okay. And then again I'm going to get my 4mm needle, and I'm going to enhance the top and the bottom lip before massaging them, and we should then be done. Okay, so this is the lip tubercle that we're wanting to enhance there. You can see the wet-dry border is about there. We're wanting to keep in the dry part of the lip. So I'm going to deposit a little bolus there, little stab, and about just under 0.1. Okay. Same on the top lip. Just going to put some pressure on there to stop any bruising, and then we'll give them a massage and see if we do need to do any evening up. That feel okay?
Mm-hmm.
Yeah. This lady has had cold sores in the past, so I will be giving her some acyclovir. I'll give her a 3-day course from today just to minimise the chances of developing a cold sore. Lip filler is a known trigger for cold sores. Okay, so we'll just get some balm and we'll give those a massage. So this balm has arnica in it and chlorhexidine, so a good antiseptic. Just give it a firm massage. So you're not wanting to flatten that ball of filler that you've put in there. So the ball of filler is going to give you the projection and volumization in the region of your lip tubercles. So it's more about just smoothing and helping with any sort of integration, so you've got no edges and lines. Same with the tops. I'm just going to reach over. The gauze just gives me a bit of traction. And open your mouth slightly for me, and they look nice and symmetrical. So I'm just going to put a little bit of pressure and just stop that bleeding. So the only real swelling you tend to get is when you start puncturing with a needle. So we've got 2 little needle puncture points for you there. Aftercare for our patients, they shouldn't need to do any massaging. So if there's any lumps or bumps, that's for me to sort out today. It'd be very unusual to get lumps with this product because it's very fine and it integrates beautifully. Key aftercare, I would say keep everything off your face for the next 3 to 4 hours. These are our key entry points that we use for the cannula, but we've then used a needle on Tina's lips as well. So the body's very quick at healing holes, but just a few hours, let that settle. No direct heat onto the lips tonight. If she has a hot drink, use a straw and don't put the cup in contact with the lips. And of course, aftercare for our patients, I always make sure I'm available. Things I would be wanting to look out for would be signs of a vascular occlusion, and that would be pain and discoloration. So I would tell my patients if they've got any increasing or escalating pain, then to come back to me. But we can see that Tina's tissue is nice and pink and that we've got no areas of concern or blanching. So I think that's a fabulous result.